What's going on, everyone? It's Alex here from Aleks Physio. So today we're going to be talking about when should you be concerned about mid-back pain. Welcome. For those of you who are new to my channel, my name is Alexander Kravich. I'm a physiotherapist in Vancouver, British Columbia, and today we're going to be talking about when should you be concerned about mid-back pain. We're going to be going over 5 questions that I, as a healthcare provider, would be asking you, and questions that you can ask yourself to determine whether or not this is something to be concerned about. So let's get right into it. Question 1 is your pain mechanical or non-mechanical? So what does this mean? Mechanical is something that is provoked by changes in positions or postures or load that are being applied to your spine. So if you're sitting for long periods of time, standing for long periods of time, that tends to cause my pain. But when I lie down on my back or lie down on my stomach, that tends to make the pain feel better. That would be an example of mechanical mid-back pain, whereas non-mechanical mid-back pain or non-mechanical spinal pain would be pain that doesn't really change whether or not you are in different positions. It's just always going to feel the same. You're going to have that constant pain, and no matter what position that you're in, if you're in a gravity independent position or gravity dependent position, your pain is going to be the same no matter what the load is on the back, whether it's higher or lower. So if it is non-mechanical, then that tends to raise some eyebrows for us when we're asking this question. Question number 2 is, do you have any constitutional symptoms? So constitutional symptoms are things such as fever, chills, nausea, night sweats, unexpected weight loss, or weight gain. These are the questions that you want to be asking yourself. And is there a correlation between the onset of the symptoms that you're having and these symptoms that you're having concurrently, and if there is any form of connection between the two? And at the end of the video, I'm going to be explaining a little bit of why these questions are asked and what the practitioners are looking for when they're asking you these questions at your appointments. Number 3 is the pain getting better, same, or worse? So what has the pattern in the pain been? Has it been getting better since it started? Has it been staying the same? Has it been getting worse? What kind of period of time are we talking about? What is the trend? What is the general pattern and the trend in the symptoms since the onset and when it came on? Number 4, what is your past medical history? So do you have a history of osteoporosis? Do you have a history of high blood pressure, cholesterol, smoking, alcohol? History of cancer, history of GI disease? Anything that is medical or pertinent to the story is something that is worthwhile asking, and to determine whether or not there is a link between any of your past medical history in comparison to the current pain and the symptoms that you're experiencing now. Number 5 is, do you have any other symptoms? Do you have any other symptoms that came on at the same time that you started experiencing your mid-back pain? Do you have any numbness? Do you have any weakness? Do you have any pain that travels down your arms? Do you have any pain that travels down your legs? Do you have any issues with your bowel or bladder? Do you have any incontinence or peeing your pants, pooing your pants? Do you have any nausea? Do you have any vomiting? Do you have any, again, GI system symptoms? Is there anything that has come along around the same time that you have been experiencing these symptoms? Let's talk a little bit about why these questions are being asked. So when we're talking about mechanical versus non-mechanical, we're looking to try to see, well, if it's something that's related to prolonged static postures or doing repetitive work over a prolonged period of time, that should get better when you lie down, because there's no load on your back, or there's much less load in comparison to those positions, and you should get some level of relief in your symptoms when you're lying down versus if you're standing and walking and moving and sitting for prolonged periods of time. There should be some change in the symptoms. If there isn't any change in symptoms, again, that's when we kind of raise our brows a little bit, because we're looking if there is something else sinister going on, like a red flag. If we're looking at something like a tumor, or possibly cancer, or possibly a spinal cord compression, because these things, if they are happening or going on within your spine, they tend to not really get alleviated with changes in position, because if there is a tumor there, or there's something that's irritating your spinal cord in that region, or the bones in that area, or your discs, then that should be better when you are lying down or in a position that tends to take some of the pressure off those structures. So if there's no change in your symptoms with lying down, then that kind of causes us to raise our our brows up a little bit. Number two, for the constitutional symptoms, we're looking at the fever, chills, nausea, night sweats, unexpected weight loss or weight gain. We're looking at any signs of an active infection. This can be correlated with, have you ever had any, or have you had any recent dental work, any procedures that may increase the risk of an infection? So we're looking to see, is there an infection in your spine that is causing some of these constitutional systemic symptoms that you are experiencing. And if you are having some of these symptoms like, oh, I've lost 15 pounds over the last month and there hasn't really been a change in my activity levels or my diet or how much I'm exercising, then again, these are things that we have to be a little bit more mindful about and raises some cause for suspicion. The third one that we talked about was pattern, better, same, or worse. We're looking at the general trajectory of the symptoms. Most people who have mechanical pain has a tendency to get better over a period of time. But if the symptoms have been on for 3 to 6 months and there hasn't been any change in your symptoms and the symptoms are getting worse and you've tried medications, physiotherapy, massage therapy, chiro, and nothing has really been helping, then again, this kind of raises us some questions to be concerned if there's something else sinister that's going on that's explaining the pain and why it hasn't been getting better. Number four, the past medical history, things like osteoporosis, issues with your GI system, history of cancer. A history of cancer is a very strong predictor of any form of pain in your mid-back, because there are certain types of cancer like prostate, lung, and breast cancer that have the ability to metastasize or spread to other parts of our body, like our spine. So we're looking to try to rule out any form of metastatic cancer. So if you mention that, I had cancer recently and I'm still undergoing cancer, some of these cancers that were mentioned before, we always want to try to rule out any form of metastatic cancer or affecting the spine that is causing your symptoms. And then in addition to, if you have something like osteoporosis where the integrity of your bones has been decreased, well, if you do something trivial like pick something up from the floor, or if you cough or sneeze, that has the potential to create possibly a fracture, which again would be a red flag and not just your typical thoracic spine strain, sprain of the muscles or ligaments or tendons in that area. So we're looking to try to rule out a fracture, metastatic disease, infection, tumor, some of these red flag conditions. Question number 5 about, do you have any other symptoms? This is where we're looking to try to see if there's anything that has come on in association with these symptoms when they came on or a little bit after. So the numbness, the tingling, the weakness in your arms, legs, the issues with your bowel and bladder, these are things that could indicate something that may be irritating the spinal cord in your mid-back. Say that, I started having this mid-back pain and now I have pain that's traveling down my legs, or numbness or bowel or bladder issues, then this is something that would raise some concern for a possible red flag condition. Now, it's important to note that red flags are very rare, things like the tumor, cancer, infections, inflammation, fractures. However, it's important to always be mindful of them whenever somebody is coming in with some sort of pain, because sometimes pain or musculoskeletal pain can mask an underlying more serious non-musculoskeletal condition, especially if you've answered yes to some of those questions that I've asked earlier today and that your healthcare provider would be asking. So it's important to be mindful of that, that it is rare. However, it is something that we still want to screen. Most cases of thoracic spine pain that has been relatively acute tend to get better if there was an associated mechanism of injury. So if you were lifting something and maybe you felt a little bit of pain, but you're overall young and healthy, or if you work at a computer or you have been more sedentary, these are reasons where we tend to not be as concerned. And if you didn't answer anything that would cause us to be concerned for those previous 5 questions, then obviously the likelihood that this is something that would improve would be higher. However, it's always something that we just want to make sure that we're ruling out whenever somebody comes in to the clinic. And then, of course, this is just the subjective portion of the exam. The objective portion of the exam would confirm the suspicion or refute the suspicion of any sort of red flag going on. So we would check things like your reflexes, your strength, your sensation. We would check any other red flag tests that look at your reflexes that I'll explain in another video to help confirm our suspicion that this is something that's just musculoskeletal related. And if it confirms our suspicion that it isn't musculoskeletal related, then this is where we would obviously look to try to get further investigations done, whether that be an MRI, an X-ray, a CT scan, any form of blood work, if there is some query inflammatory conditions that are explaining some of your pain. So these are, things that we would want to be mindful of. There you have it. We went over 5 questions that a healthcare provider would ask you if you are coming in with mid-back pain and when it may be a concern, and questions that you can ask yourself as well. So the 5 questions that we would ask is your pain mechanical or non-mechanical? The second question would be, do you have any constitutional symptoms, fever, chills, nausea, night sweats, unexpected weight loss or weight gain? The third question is your pain getting better, same, or worse? What is the pattern of your pain? The fourth question is, what is your past medical history? Anything that I should be aware of that may be contributing or predispose you to some of these conditions of a red flag that's going on? And then the last question is, are there any other signs or symptoms that you have been experiencing that have come on around the same time that you have had your pain or slightly after? So hopefully you found some value in this video. I know it's easy to look online and just see, mid-back pain and do a bunch of different exercises, but it really is important to get yourself checked out, especially if the symptoms have been worsening and it's been that period of time in which most musculoskeletal conditions do get better. So that 6-week to 3-month period, it's important to see somebody to get it checked out to make sure that there isn't something else sinister going on that can mask itself as just, mid-back pain as a result of quote unquote poor postures, or if you're just doing something repetitively. So make sure you get it checked out if you are concerned about your symptoms, and ask yourself those 5 questions. And also just know that when somebody is asking you these questions, these are the things that we're trying to look for to rule out. So hopefully you found value in this video. Have you had mid-back pain, or have you been experiencing mid-back pain? What has your experience been like within the healthcare system? What has worked? What hasn't worked? Have you found out that it is something more than just, regular mid-back pain, like a strain, sprain of the muscles or tendons or ligaments? Let me know down below if you do feel comfortable sharing that information. If you find value in my channel, consider checking out some of my other videos. I have over 450 videos on various physio, exercise, and medical related topics. And if you still find value, please consider subscribing to my channel. It really allows my channel to grow and allows me to reach a wider audience. Until then, we'll see you in the next video. Thanks for watching.